So opioids probably aren't the best solution long-term for chronic pain. I think people would acknowledge that. Now there are some people where they work well, they're effective, people get better, people have better lives. So we're talking about the large group of people who aren't doing well, who get worse, who become dependent or addicted. We really need to spend time with those people, hearing what they have to say, facing their fears, because really the issue is that when I cut back on my medicine, my pain goes up. So who wants to stop? Because then my pain would go through the roof. And the truth of that matter is that if we walk people through coming off opioids in a structured pattern, they will have a better life, but it's going to take a week or 2 or 3 or 4, depending on the way the practitioner does it. So physicians need to be more expert in the weaning process and in the communicating process. I think that what's missing is having a frank conversation with patients about what our limitations are and how life might be, and really facing up to that, and then holding their hand to help them get through it, using other resources that are non-pharmacologic, like meditative practice and motion and exercise. The goal of eliminating pain is an unrealistic goal. Life is full of pain. The older we get, the more damage we have to our tissues, the more likely to have some or many sources of pain. So, you know, that old expression, pain is inevitable, suffering is optional, and really part 2 of the question about can we help people manage their lives, have better lives, and not focus on the pain level, but rather on what's my life like. So I think that every pain doctor should revise the first question that they ask from what's your pain score to how's your life, and then expand on that and really know, are you exercising? Are you out of bed? Are you enjoying your life? Are you hanging out with your grandchildren? Are you working? Or if not, what are you doing that fills the time that is of quality? I think over time, eliminating pain as the 5th vital sign would be a positive move, because focusing on pain, especially in an acute care setting, really leads to medicating. Even a short amount of medication, 10 days or 30 days use of an opioid, it correlates with long-term dependence on opioids in a substantial percentage of patients. So we ought to really be focusing in an environment on how are you doing today, and not what's your pain score, and calibrating a pain score and correlating it with medication. For patient satisfaction to be directly tied to treatment of pain and focusing on satisfying patients probably is the wrong endpoint. You know, it really ought to be about the patient's function and how are they doing, and what is their quality of life, and how is their longevity and their management of their chronic conditions, and not what's your pain score and how much do you like your doctor. There was one study that said satisfied patients have shorter longevity, they die faster.